Hi, so this is module 3 of the VMSG training. We are going to be working with the activities level today, so this tab up here. But just as a refresher, starting with the services and initiatives, I'm going to be working with track and monitor infectious disease X, so number 1. Going to the goals, also number 1. Objectives, reducing the incidence by 15%. And then getting to the activity level. Now, you should all have the following infographic, and I just want to go over this each time we do a new activity. So project-based activities are very much goal-oriented activities, right? So they may not have a time frame. It often involves planning, execution of tasks, and monitoring tasks. Often also utilizes or involves collaboration, whether team collaboration or stakeholder collaboration, also resource management and sticking to timelines. A good example of a project-based activity is either vaccine campaigns, maybe implementing health education programs, or simply renovating facilities. Now, getting back to VMSG, and just to make things a little bit faster, I'm going to be working on a Google Doc or with a Google Doc. So our first activity, and we do it the exact same way we have been. So here you can see this is where you would change it. So we are at project-based. Our performance metric may be as simple as an analysis report. So conduct a comprehensive analysis of surveillance data to identify trends. Here, our performance metric analysis report. We could put in a date. So if we do want to do that, and up until next year. And then just a quick note. So very often, and this is specifically for new hires, or if multiple people are going to be working with a specific activity, a good way to go about this is using the notes as a step guide, right? So step 1 is following these instructions. Step 2 is this instruction. All right, so we're going to save this one. Getting back to first, our second kind of activity, which is quality assurance. Now, quality assurance activities focus on maintaining and improving quality of processes, right? So this can include establishing standards, guidelines, procedures, but it's to ensure some kind of consistency. Very often, this also involves monitoring, evaluation, and gaining, appropriate feedback. So a good example of this is to conduct audits, reviews, inspections. So we're going to get back to our quality assurance. And this is, okay, we're going to add another one. Now, with quality assurance activities, you can enter exactly how many, audits or inspections you want. So I want about 90, maybe, and this could be annually. You have all of these options. So we're going to do annually. We want 90 inspections done, starting date, and then red doesn't necessarily refer to things aren't done. It just means that we're not where we want to be. So we want to be at 90 by the end of the year. Between 20 and 90, that's when we're working towards that 90. So yellow means we're getting there. Red just means we're not where we want to be yet. It also doesn't refer to we're not on tracks, because obviously you're going to start in the red. And then our metric could be, inspections done. If we're working specifically with inspections, I believe this activity is more on education campaigns. So we would do education campaigns done. Okay. Okay, and you would skip the done then. Again, with the note section, and this just adds who made this change or who added these notes. Again, maybe having specific steps, right? All right, so we're going to save this one. Getting back to our infographic, again, you should have this infographic in the training schedule. Our quantitative activities, these are very much data and metric kind of activities. So it often involves collecting, analyzing, and interpreting data. A good example of this is tracking patient outcomes or monitoring disease prevalence. So getting back to our Google Doc, quantitative measurement. Again, changing the activity to quantitative measurements. Now I just want to read over this. Conduct a comprehensive analysis of surveillance data to identify trends, high-risk populations, and potential sources of transmission. Quantitative measurement, we would have a start date, we'll make it today, and then an end date, which would be, again, maybe next year. Our target number, this is how many analyses we want. So maybe we want 20. Okay, we'll save this. The analyses, and then again, step 1, and you would have your various steps, and we'll save it. So again, this infographic, just getting back to this, has all of the, basics of each activity. I also have examples here. So if we're working specifically with this objective to reduce smoking at a specific high school by 25%, a project-based activity year would be to create that training content, right? Certain materials. A quality assurance activity would be the training sessions we're grading. We want about 9 each month. This is a little excessive, but about 9. And then our performance metric, green would mean we got to the 9 each month. Anything below 6 would mean, we're still working towards that 9. So yellow, 6 to 9. And then quantitative measurement, contact all 20 tobacco vendors within 1 mile. So our performance metric here would be the 20 tobacco vendors contacted, right? Or the 20 tobacco vendors. And that brings me to the end of the Module 3 activity. Please do look at the scribe as well and the infographic if you do need a refresher.